Medicare supplement price increases in 2024 ended up being the highest since 2011, and in this video I'm going to explain to you why and what you need to know and how it impacts you if you're on Medicare. My name is Christian Brindle. I'm a Medicare health plan expert and specialist, and I'm also the founder of an agency called Christian Brindle Insurance Services, also known as Everything Senior Insurance. And today we're talking about Medicare supplement plans. So in 2024, according to CSG Actuarial, which is one of the premier data organizations out there that tracks the metrics and statistics when it comes to Medicare supplement, also known as Medigap, price increases. Now, if you're not familiar with what a Medicare supplement is, let's first start there. So a Medicare supplement plan is a secondary insurance that goes with Medicare. So when you have a Medicare supplement plan, Medicare is your primary, the Medicare supplement plan is your secondary, and between the two, you are double covered in most instances as long as the service that you're getting covered is a Medicare covered service first. Medicare only covers things like medical bills such as doctor's appointments, hospital stays, surgeries, durable medical equipment, etc. And so because of that, Medicare supplement plans only cover the same items as well. So when you go with a Medicare supplement plan, typically you are picking up a separate Part D standalone prescription drug plan. And if you want dental, vision, and hearing insurance, that is also a standalone plan in and of itself. Whereas if you go the Medicare Advantage route, typically all of that is weaved in together into one plan. But Medicare supplement plans are very good coverages on the medical side. But one thing that they don't typically tell you when you first turn 65 is that the Medicare supplement plan you sign up for will continuously have price increases every single year as you get older. It's very rare, if not almost foreign, to have a Medicare supplement company not impose a rate increase on the premium in a given year. It's happened only a couple of times with a couple of companies in my career that I have ever seen. But in 2024, we've seen those price increases be higher. In fact, if we're looking at 2023 versus 2024, 2023 saw a 5.5% average rate increase if you factor in all Medicare supplement companies and plans and put them together, whereas in 2024, we saw a 7.6% rate increase overall. That's a little bit of a jump. That's actually the highest since 2011, with 2011 being an average of an 8.4% rate increase. Now, this is all plans and all insurance companies averaged together, right? So this is Plan F, this is Plan G, this is Plan N. One narrative that a lot of individuals in the Medicare space like to push is that if you sign up for a Plan N, you're more likely to see a lower price increase than if you sign up for a Plan G or a Plan F. But 2024 has not really supported that based on the facts and the statistics. In fact, if you looked at 2024 year to date, the Plan F saw an average rate increase of about 8.6%. The Plan G saw an average rate increase of about 8.8%, whereas the Plan N still saw an average rate increase of 8%, slightly lower than the other two, but less than a percentage point. Now, the bigger question remains, why is this happening? Well, the simple answer that I can give you is usually the best one, and that is that the cost of everything is going up right now due to the after effects of inflation that we've seen over the past 3 to 4 years. And medical care is no different, right? If the medical costs of things to cover you goes up, hospital costs go up, doctors' costs go up, equipment costs go up, test costs go up, the cost of healthcare in general is going up. As a domino effect, your Medicare supplement costs are also going up as a result. This can be seen far and wide. Now, that being said, what is it that you can do if you are somebody on Medicare? Well, Medicare supplement plans allow you to change from one company to another if you're healthy enough to do so, if you can pass the health questions and the underwriting to do so. Remember, Medicare supplement plans are what's known as standardized, meaning that every single insurance company that offers Medicare supplement plans are all offering the same plans. A Plan G, a Plan F, a Plan N, the only thing that differentiates them from one another is that they all cover a different amount of what Medicare leaves behind. But they're standardized. Their plans are actually designed by the government and Medicare itself, not by the insurance companies. Meaning that the insurance companies take these plans as is, and they have to offer them and market them with the exact structure that Medicare put in mind when they actually put the plan together. They cannot alter or tinker with the coverage. But what the insurance company can do with the coverage is they can determine what the price is going to be, and also long-term what the price increases are going to be. Because of this, what we're seeing internally at my organization is that more people are wanting to shop their Medicare supplement plans, especially with it being open enrollment. Other people are actually wanting to take a look at their Medicare supplement plans if they're in areas that have high Medicare supplement costs. Areas such as Florida. Certain parts of Florida, your average Medicare supplement costs are going to be north of $200 a month. Certain parts of New York, especially in New York City, your average Medicare supplement costs are $250, $300, $350 a month and up, depending on the plan you're looking at. Whereas if you look at this and you factor it in that you're going to spend in some areas $2,500 minimum a year in premium, $3,000, $3,500, $4,000 a year in premium for your Medicare supplement plan, that sometimes a $0 premium Medicare Advantage plan might make more sense for someone. That has everything factored into one with a maximum out-of-pocket cap. Not saying that's the case for everybody. Medicare Advantage plans and Medicare supplement plans, regardless of what any propaganda might tell you, both have their pros and cons and a fit for each individual. That's what we recommend, and that's what we teach internally with our clients. But at the very least, even if someone is sold on the Medicare supplement model, if you're healthy enough to pass health questions and you can move from one plan to another if you've been hit with a massive rate increase, we've seen a lot of big name insurance companies go up 10%, 15%, and some even 20% in certain areas in 2024. If this is you, if this is impacting you, and you're just getting hammered with rate increases, and you feel like your health would dictate the ability to be able to pass medical underwriting and health questions to be able to move to a different Medicare supplement plan, you might be able to get the same plan you have now, but chop your costs down significantly. That, my friends, is the only way to take advantage of this situation and be able to keep up with everything and not get buried in the long-term price increases. Costs of everything are going up. You feel like you're getting squeezed. Your Social Security increases might not be as much as you would have hoped for, but one thing you can control is making sure that you're getting the best value for your Medicare supplement plan. Now is probably as good a time as any to make sure that you're shopping your rate, make sure that it is the best one that you can possibly be on, and make sure that you're with a company that long-term has a favorable rate increase history. So that way, long-term, if you do end up getting stuck on it, if your health goes south, then you don't get hammered and raked over the coals by some of these rate increases. We estimate that we'll see more of these same type of price increases in 2025, so we recommend you have your rate checked today. My office can do it at no cost, no obligation. Our office number is 801-255-5340. Again, 801-255-5340. And we're licensed in over 45 states. Give us a call today. There's no cost, there's no obligation. At the very worst case scenario, if we take a look at it for you and you're on the best thing for you, then that way you can sleep better at night having that reassurance. Hope you found this video helpful, educational, insightful on kind of what's going on with these Medicare supplement price increases that we're seeing. And if you did, please do us a favor. Smash the like button for the YouTube algorithm. It's going to help so many more people like you that are getting hit with these massive rate increases find this video easier. Make sure to comment your thoughts down below. Why do you think this is going on? We'd love to have a dialogue with you about it. What are your thoughts on it? Do you think it's terrible? Do you think it's not that big of a deal? We'd love to have some conversation with you about it. Comment your thoughts down below in this video. Make sure to subscribe. We put out weekly videos to help you understand your Medicare options better. And without further ado, thanks so much for watching all the way to the end. We'll see you next time, everybody, and happy Medicaring.